Most doctors' offices have been full of children with cases of RSV, COVID, and flu, and many parents have questions on how to identify if it's a severe case or something that can be treated at home. Plus, how do you properly treat the virus at home? Well, joining us to answer all of those questions and more is Dr. John Cox. Dr. Cox, good morning, and thank you for joining us.
Thank you for having me.
Now, you told us off camera that we're talking RSV, but flu is prominent right now.
Right now, yeah. I mean, at any one point during the year, there's multiple viruses doing multiple things, and viruses do not wait their turn. Kids are getting hit with multiple things at one time sometimes. So right now, influenza has kind of taken the lead and is running the show at the moment.
So what are a few signs to tell, a parent to look for when their kid is sick? How do we determine? You said there's very slight differences between the three viruses.
Yeah. Most of them are all upper respiratory infections. There's two things that make you sick: viruses and bacteria. Bacteria become more and more and more. You get sicker, sicker, sicker. Viruses hit you hard first. The first 3-4 days are fevers. So the first thing you want to recognize is, A, if you have a fever, treat those fevers. Let those fevers, make sure those fevers drop. And with a lot of these viruses, you're getting those 103s, 104s. Yeah. Parents hear a number and they want to run to the emergency room. Numbers aren't really the issue. It's the whole big picture. Kids are big picture creatures. Give them their Motrin or their Tylenol, make sure that temp drops. See what that kid looks like as that temperature drops if they perk up in between. And as always with little people, drinking and peeing is your main thing. Okay. Those are the basics.
So staying hydrated, getting that 100%. Water in their system.
That they're actually able to want to drink, that they're able to do that and go out do that on their own, especially for the little babies. That's the ones you really want to watch out for.
So how do you know when it's time to come see you or go to the hospital?
Yeah. Well, anytime you're nervous, there's a no freak out zone in my office. So if you're freaked out, you call me.
Yes.
But if their drinking drops off ever, that's when you want to call. If their fevers are not dropping, you want to call. If they are looking like they are breathing 40 to 50 times a minute and breathing super fast, although if they're breathing that fast and their brain has to choose, do I want to breathe or do I want to drink, breathing wins. Okay. So that'll show you that the drinking drops off. So whenever drinking drops, something's up.
And we're hearing that parents are going to stores and they can't find children's medicine. Yeah. What do you do? I've been hearing a lot of different things. People saying crush up adult pills or ibuprofen. Some people are saying, no, don't do that. What should we do?
It depends on what's out. There are different products as far as fever reducers that you can find usually. A lot of the cold medicines you're having a hard time with. So you can do just some saline and suction, especially on the little babies. The old school Vicks and the vaporizers to help with the menthol to open up airways and things like that. So there's certain things you can do at home, but that's what we're trying to tell people. Don't stock up on those things. And also, everybody thinks that antibiotics are going to fix everything, and they do not. Antibiotics only work on bacterial infections, and 90% of what we're seeing is all viral. So you're doing supportive care and making sure that they're doing okay. So there's also, I've heard there's been a shortage of the amoxicillin because a lot of people are just prescribing it just in case. So be aware of that too.
So let's talk about prevention. Is there any way to keep our kids from getting sick? I know it's the holiday season and they're, especially the little ones, they're being passed around from, family member to family member. Those are things we should probably limit.
You should try to, especially for those tiny babies. Best place to kiss a little baby, feet, top of their head or their back. If you avoid face and hands, you're going to keep those little infants safer. Washing hands, making sure that if people are sick, they are either masking up or washing their hands or distancing themselves from their families. But it's all about prevention. Pediatrics is all about prevention. I'd rather you walk around a hole than fall in the hole.
I love that. I like that. Yeah. That's really good. Never heard of that. Thank you so much, Dr. John Cox. Great information. That's really some news that we all could use right about now. It is now time for